Okay, so this is inside the aircraft. Normally the doctor would be sitting in this position, the paramedic or nurse would be sitting in the other position, and the pilot is in the right hand side of the aircraft and the crewman on the left. We have a patient stretcher that can be configured both east-west and north-south. Normally when there's a patient on it, we have it in the north-south position, so the head of the patient is sitting just up here. And then in the back of the aircraft, we've got all our equipment. So the top shelf, the top two containers is all medical equipment, and the bottom container is rescue equipment. So just briefly, on the bottom is a rescue stretcher and a single patient adult extrication device. Then up the top we have our monitor, which allows us to monitor blood pressure, heart rate, oxygen levels and carbon dioxide levels when people are breathing. It can also do what's called invasive pressures, which are when you have a special catheter in your artery, so it gives us your blood pressure with every beat of your heart. There's also a defibrillator in here that can restart hearts that are in abnormal rhythms, and we can even pace people as well. So if their heart is running too slowly, we can actually put pads on them and speed their heart up electrically externally. As well, in here we've got what's called our OxySoc, which is basically our oxygen supply and a portable ventilator to allow us to breathe for people when they can't breathe on their own. We've got some patient equipment in here, like earmuffs and goggles for people if they're in the aircraft. And then we've got some other excess equipment in the back here. Then on this side we've got our two major medical packs. There's a red pack and a blue pack. So the red pack has most of the equipment we need for supporting people's circulation, all of our drugs, and also the ability to perform minor procedures, putting drains in people's chests if their lungs have collapsed, or doing minor surgical procedures in the field in this pack. And then in the blue pack we've got all the equipment that we need for helping people breathe. So we've got instruments to be able to put breathing tubes in, similar to giving an anaesthetic in a hospital. We've got a range of tubes all the way down from neonates up all the way up to adults. We've got a portable ultrasound, so we can actually ultrasound your chest and your abdomen in flight, and a manual bag to be able to ventilate people if we need to do that as well. We also carry blood. We not only carry blood, there's actually plasma in here as well now. These eskies are military grade eskies. They keep the blood and the plasma at 4 degrees centigrade for up to 36 hours. We carry 2 units of blood, which is O negative, which is universal donor blood, so that can be given to anyone, and 2 units of what's called ELP, or extended life plasma, which has a lot of the clotting factors that people lose very quickly when they're bleeding from trauma. We also have the ability to warm the blood, and then we have some other devices to help stop bleeding as well in major hemorrhage. And that's about it.